Olá todo mundo, bem-vindos novamente para o nosso podcast da Oncologia DOR, direto do Congresso da Oncologia DOR, Onco em Rio, aqui no Rio de Janeiro. E agora a gente está com uma presença extremamente especial, doutora Faye Dent. Ela é oncologista no Wilmot Cancer Center, ela é diretora da cardio-oncologia nesse hospital, e ela ainda é professora de medicina na Universidade de Rochester, em Nova York. E ela vai falar aqui no Congresso sobre todos os efeitos de cardiotoxicidade dentro daquilo que a gente tem junto do tratamento oncológico. Então, welcome, Dr. Dent. Thank you for coming. Thank you to be with us. It's very important to be someone like you here in our Congress. It's our 10th edition. So every year we try to do something different, and the podcast is an upgrade we received this year. Actually, we did it last year, and this year is a little bit larger with more people because it was a success. So we try to bring some different people like you to help us to understand how oncology is important, and more than that, how other things around oncology are important than you just do like a cardio-oncology. Okay, so I will start here with the first question. Cardio-oncology is a growing field, especially with the advance of cancer treatments. In your opinion, what are the most important ways artificial intelligence can help oncologists and cardiologists collaborate to improve the patient care?
Well, first of all, thank you for inviting me to this wonderful conference, and particularly to speak about a topic that I am so passionate about, which is cardio-oncology. So at this Congress, I'm speaking on artificial intelligence in cardio-oncology, which is something actually relatively new to me. I'm not new to cardio-oncology. I've been doing it for 15 or more years. But the whole idea of how can we use artificial intelligence in cardio-oncology, I think is still relatively new. So having said that, I think, we've witnessed the infiltration of artificial intelligence throughout our whole lives and everything we do, including medical oncology and healthcare. When we think about cardio-oncology specifically, I think one of the areas where artificial intelligence can really help us is trying to determine who are those patients with cancer who are at greatest risk of experiencing cardiovascular toxicity from their cancer treatments. So, we see patients in our practice, they're older, they may have pre-existing cardiovascular disease or cardiovascular risk factors, and we really have had very crude methods of trying to determine who may experience cardiovascular toxicity from their cancer treatment. There are some models out there, and we were sort of involved in one model where we took together the demographics of patients and we looked at their risk factors, prior exposures to treatment, and we came up with these risk proforma that were published with the European Society of Cardiology and the International Cardio-Oncology Society. But still, a lot of this was based on expert opinion. So what artificial intelligence can do is I think they can take all the variables of one individual person, and that is what kind of cancer, what treatments are they going to be exposed to, what risk factors do they have. Not only that, they can look at things like lifestyle factors. Are they a smoker? Are they obese? And put that into a machine learning model and come out with this person is at risk. So I think this is going to be revolutionary for us because, 10 to 15 years ago, as oncologists, what we were doing is we were just saying, well, they're 65, they'll probably be fine. We'd give them the therapy and then they would develop toxicity, and then we'd send them to the cardiologist and say, can you help them so that we can give them therapy? We were just sort of, it was a very reactive approach. This, I think, is such a proactive approach. And if we really want cancer patients to have access to the best therapies, we have to make sure that they're able to, have those therapies without causing more damage. And importantly, if we can identify who's at risk, then we can think about ways to prevent that risk, right? We can say, well, maybe we can put them on some protective medications so they won't experience that toxicity. So that is sort of really, I think, going to change the landscape in cardio-oncology.
normally in our activities, we not worry about this kind of differentials. We are looking for the treatment, looking for the cancer as a disease. And if you have a reminder, as you said, because we put all we have this information inside our medical records. So someone just remember, look around these patients maybe have a problems. Will be easier to take care, to prevent, as you said. That's I think it's the main goal: prevent the problem, the later problem.
So many of us now use electronic medical records, and we put our chemotherapy orders or our cancer treatment orders into an electronic system. If that system can be taught to flag, first of all, to figure out who's at risk and to flag that risk for the oncologist, because we also know you can't create systems that are too cumbersome, and oncologists are very busy already. But if we can have a flagged system when you're seeing someone putting in orders, I think, this might be a possibility that we can do that. So we don't want to make oncologists' lives harder. If anything, I think we should be using artificial intelligence to make their lives easier, and that those models that you build take away some of the thinking around, okay, is this person at risk or not? And then, engaging the cardio-oncologist to help you manage those patients through their treatment. And, when I started in this field over 15 years ago, people said, well, that just is going to mean you're going to stop their cancer therapy. And it's not at all about stopping their cancer therapy. It's about continuing their cancer therapy
in the right way.
In the right way, particularly for people who are living with metastatic disease now, who could be on treatment for years now. We need to make sure that they can stay on it if it's working for their cancer.
Great. Prevent medicine is one of the things I love, and it's be easier to work with things like that. During the event, you discussed the use of EA in cardio-oncology. Could you give us a brief overview what you'll be covering and how the technology can assist your decision making to cardiologists and oncologists?
So one of the things I'm going to be covering in my talk today is, first of all, recognizing how important AI is in cardio-oncology, but also recognizing that we need to work together, to combine data sets from both cardiology and oncology so that we can create learning modules. So you can't do that unless you have very good data. Exactly. So we are definitely going to need more data, more prospective studies and registries where we collect this data so that we can put that data into a machine learning module. But I'm also going to give some examples, and this is what I think really I find so fascinating. There is already a validated ECG called an AI ECG learning module. And there are a couple of studies now that have been done in patients with cancer. And what they were able to do is, by doing a baseline ECG and applying this module before they start cancer therapy, they can predict who is going to develop left ventricular dysfunction.
Amazing.
And so they've done this in a study at Yale. And then there's another study they did in patients with CLL, come out of the Mayo Clinic in Rochester. And they did same thing. They looked at a baseline ECG and they were able to predict who developed atrial fibrillation. And that's important because the treatments for CLL are drugs, the Bruton tyrosine kinase inhibitors, that can promote atrial fibrillation. And this can be really devastating for our patients. So those are just two examples, which I just find fascinating, that you can do an ECG and you can determine who's at risk.
Simple, totally simple, and available in any place, so it will be very helpful. I remember in 2012, I went to Singularity University, and the first time I saw the Alive Core, one gadget to use yourself. In iPhone, you just put it and can do your ECG and send a message for your physician. More than 10 years ago, and now we have this kind of opportunity to do something so different. You can,
and I think so simple, right? So simple. Doing echocardiograms is a very intensive, expensive test, but many centers have access to a 12-lead ECG. This is an inexpensive test, accessible to many patients. So wouldn't that be lovely if we could say, if you have this test, you're at low risk, you'll be fine. If you're at higher risk, you need maybe some closer monitoring, and these are some of the things that we need to help you get through your treatment.
Yeah,
I think it's amazing.
Simple and very effective.
Yeah.
That's the idea. So, Professor Dent, thank you so much for coming. I hope your speech will be amazing. You are very kind to be with us here, and I hope next year we can have you again with us in a new speech with different things in AA or cardio-oncology. Thank you so much for coming.
Thank you for inviting me. Thank you.
É isso aí, pessoal. Estivemos aqui com a doutora Susan Dent, uma conversa muito legal sobre inteligência artificial. A gente vai terminando por aqui e espero ver vocês no próximo episódio do nosso podcast da Oncologia. Até lá, pessoal.